Cancer is not diagnosed by guessing. Doctors don't rely on feelings. They rely on evidence. They look at real cells. They test real tissue. In this video, you will see how cancer is detected. You will see how tumors are tested. And you will learn why cancer becomes dangerous when it spreads. Diagnosis means finding the truth. Not guessing. Not assuming. Doctors collect proof. They collect samples. They study those samples carefully. Only after that, they confirm cancer. This process protects patients from wrong treatment. A biopsy means taking a tiny sample. The sample comes from a lump or from an abnormal area. The sample is very small, but the information is very big. That small piece tells doctors what is happening inside your body. Biopsy is not only for lumps. Doctors can take samples from the stomach, from the intestine, from the breast, from the lungs, and sometimes from blood. The method changes, but the goal stays the same: to study real cells. Once the sample is taken, it must be protected. It cannot dry out. It cannot change shape. It must stay the same. So doctors preserve it carefully. This keeps the test accurate and prevents wrong results. In the lab, the tissue is set in wax. The wax makes it firm. Then very thin slices are cut. These slices are almost transparent. Thin slices help doctors see cells clearly. Without thin slices, cells look crowded. Details get missed. Doctors look at the cells under a microscope. They study their shape. They study their size. They study how they are arranged. Normal cells look organized. Cancer cells look chaotic. This difference guides the diagnosis. Not every tumor is cancer. Some tumors are harmless. These are called benign tumors. They grow slowly. They stay in one place. Malignant tumors are cancer. They grow fast. They invade nearby tissue. Malignant tumors do not stay quiet. They push into nearby organs. They damage healthy tissue. They create pain. They prepare to spread. This is why malignant tumors are dangerous. Cancer cells can travel. They move through blood. They move through lymph. This movement is called metastasis. Metastasis means spread. Once cancer spreads, treatment becomes harder. Cancer may start in one organ, but it does not stay there. Cells can travel to lungs. They can reach the liver. They can reach bones. Now the disease is in many places. This is why spread is dangerous. Localized cancer stays in one area. It is easier to remove. Metastatic cancer spreads to many organs. It is harder to control. Treatment becomes longer, and recovery becomes tougher. Cancer grows with time. Small tumors grow bigger. More cells travel. More organs get affected. Finding cancer early saves lives. Early treatment works better. Delay makes things harder. Some signs should not be ignored. Unusual lumps. Sudden weight loss. Long-lasting pain. Symptoms that do not go away. These are warning signs. Early testing can protect your future. Screening tests find problems early, before symptoms appear. Mammography checks the breast. Other tests check other organs. Screening does not mean cancer. Screening means safety. Some cancers grow in blood. They don't form a solid lump. Doctors look at blood counts. They check how many white cells are present. They check their shape. Abnormal patterns raise suspicion. Blood tests become the first warning sign. Reports guide every decision. They show what is normal. They show what is abnormal. Doctors use reports to plan treatment. Without reports, treatment is guessing. With reports, treatment becomes targeted. Waiting for results is hard. The mind creates fear. The body feels tired. This waiting period is emotional. Support during this time is important. No one should wait alone. Cancer affects families, not just patients. Support gives strength. Kind words help healing. Presence reduces fear. Emotional care is part of treatment. Many people delay testing. They hope it will go away. They fear bad news. They stay busy with life. But delay gives cancer time to grow. Testing early saves options. Doctors don't decide alone. Teams discuss reports. They study scans. They plan the next step. Every decision is reviewed. This protects patients from mistakes. Not every lump is cancer. Some are simple cysts. Some are harmless growths. Tests prevent panic. Testing gives clarity. Clarity brings peace of mind. Some cases need monitoring. Doctors repeat tests. They compare old reports with new ones. Changes over time reveal truth. Monitoring protects from sudden surprises. Patients can help doctors. Notice symptoms. Share changes honestly. Follow test schedules. Ask questions. Being aware saves time. Small signs matter. Small lumps matter. Small pain matters. Ignoring small signs lets big problems grow. Small action today prevents big trouble tomorrow. Testing creates stress. Fear is natural. Breathing helps. Talking helps. Support calms the mind. Mental strength supports physical healing. This video is for education only. It does not replace a doctor. Always seek medical advice. Tests and treatment must be guided by professionals. Diagnosis is only the start. Treatment comes next. There are different options. Some remove tumors. Some target cells. The next video explains these clearly. In part 3, you will learn treatments, surgery, radiation, chemotherapy, and advanced immune therapy, including CAR T cells. Simple, clear, step by step. If this helped you, like the video. Share it with someone you care about. Subscribe for part 3. Understanding cancer can save lives.